You mentioned that you've had a few fevers over the course of your pregnancy. You also seem to experience round ligament pain while you had a fever, and you're wondering if the two are related. A round ligament pain doesn't cause a fever, and a fever doesn't cause round ligament pain. The two are not connected. A fever is due to infection. It could be a respiratory illness, a stomach problem, it could be a uterine infection. There's tons of different things that could cause you to have a fever. So each time you have a fever when you're pregnant, you should call your doctor, and after asking you more specific questions, they'll decide if further investigation or treatment is necessary for that. Round ligament pain is due to the fact that you have ligaments attaching your uterus to various parts of your abdomen, and one in particular is called the round ligament. And as your uterus grows and stretches, as the baby gets bigger, the ligaments stretch too. And if you move just right, then those kind of tweak and it can cause pain. These can start as early as like the second trimester. And so they're usually associated with sudden changes in movement. So getting up out of bed, getting out of a car, standing up from on, like if you're sitting on the floor and changing position or getting up, rolling over in bed at night. It can be really intense. I had this one time when I was pregnant, and if I wasn't a labor and delivery nurse, I'd probably think I was dying or delivering my baby right then. Other times it can be a little more subtle and last a longer amount of time, but it's usually just kind of achy from about the level of your belly button on the side down into the groin area. So it runs along the track of your groin, and again, it's usually associated with a sudden change in movement. The best thing you can do is change position slowly, and when it happens, maybe try stretching, see if that helps at all, but really, unfortunately, there's not much that can be done about it. The difference between that and contractions is that contractions feel like lower abdominal cramping, lower backache, abdominal tightening and pressure. It's not usually like a sudden onset of sharp pain. And so contractions also aren't one-sided. Round ligament pain usually is. So those are a few things that you can think about if you're trying to tell the difference between the two. I hope the best for you during the rest of your pregnancy, and if you have more questions for me in the future, please feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.